If you have arthritis, osteoporosis, or any diagnosed structural issues, you've probably been told that nutrition and lifestyle changes should be your first step. But what if I told you starting with your nervous system might actually be more effective? And I get it. That was part of my story too. I started with nutrition, and I've done that for a number of years. I even got certified, because it did help me to lower the inflammation. But looking back, I would start with nervous system regulation. I know it may feel a little bit backwards, especially if you have the inflammation, the joint damage, structural changes that show up on the scans. You would probably think, shouldn't you be focusing on the anti-inflammatory diet, supplement, and physical intervention first? Because that just makes sense. That's how we've been kind of educated and told about it. So what I want to tell you, what I see in my practice is people with arthritis, structural issues, autoimmune disease, who spent months or even years perfecting their diet, taking all the right supplements, doing all the physical therapy. They're still in significant pain. And meanwhile, the nervous system is stuck in a constant state of a high alert, amplifying their pain sensations. So your nervous system is like a volume control on your pain experience. Even if you have a real structural change, and I'm not saying you don't, like I'm just giving you an idea here, an activated nervous system can turn up that volume sensation about 3 to 400. So when your pain perceives dangers, it amplifies the pain signals to keep you safe. That was part of my story. I've mentioned I start with nutrition because I have arthritis. I have psoriasis arthritis, osteoarthritis, which is more degenerative, scoliosis and fusion. But it wasn't until I start working with my nervous system and brain retraining that I've seen significant changes. So here's also the thing about inflammations, chronic stress and nervous system activation actually create inflammation in our body as well. So you could be eating the perfect anti-inflammatory diet, but your nervous system is chronically activated from the fear, stress, past trauma. You're still going to have the inflammatory process happening. And as that inflammatory process is happening, your gut lining gets it's not as sealed as it could be. Okay. And as that inflammatory process is happening, we don't absorb the nutrients as well as when we really in that rest and digest state. So it's a little bit almost like throwing money away. So when I work with my clients, again, depending on what we're working with, sometimes these two goes hand in hand, depending on your symptoms, on the doctor's recommendations. And sometimes it's a little bit of nervous system and a little bit of nutrition following the nervous system work. So I know that this may bring up fear, especially if you've been told by your physician it's just structural issue. Or that you have to manage this for life. So, but I just want you to know that having arthritis or structural changes doesn't mean your nervous system can be contributing significantly to your pain experience. In fact, it almost always is. If we stress that, like I want you to think about how that amplifies the pain signals. So here is what I recommend. You start with the nervous system work as your foundation, and then layer in the nutrition and the lifestyle as support to support that nervous system work. And when your nervous system feels safe, your body natural healing processes work better. So anti-inflammatory foods or the supplement you need to take actually work more effectively when you're not chronically stressed. So nervous system doesn't mean ignoring your diagnosis or pretending your structural issues don't exist. It means teaching your brain that you are safe. working with your fear around movement and pain, addressing any trauma that might be keeping your system activated, and learning to regulate your stress response, which I know for me, it's still something I'm working on. And yes, nutrition absolutely matters, especially with inflammatory conditions. But when you start with your nervous system regulation, you're most likely to absorb nutrients properly. You have better digestion, you sleep better, and actually stick to healthy eating plan because you're not operating from a place of chronic stress or fear. So I know some of you are thinking, but my MRI shows real damage or my blood work shows inflammatory markers. And I hear you. I'm not asking you to ignore the medical exam, evidence. I'm asking you to consider that your nervous system might be amplifying and playing a role with what you're experiencing and how you are experiencing it. And that addressing that could significantly improve quality of your life. So if you want to try this approach, start with basic nervous system regulation, breath work, gentle movement that feels safe, stress management, working on sleep quality. Notice if those changes affect your pain levels before diving into complex elimination diets or extensive supplementation protocols. So I'm really curious to hear from you about your experience with this. If you have arthritis, osteoporosis, any of the structural issues, have you noticed connections between stress and your pain levels? Have you tried nervous system work alongside medical treatment? What worked for you? Share in the comments because I think we can all learn from each other's experience.